Well, we have an extra air of excitement in the studio today. We have a brand new expert to introduce you to today.
And moms and dads, we think it is the perfect day to think about our kids' teeth. So let's meet Dr. Alexis Newman from Advanced Dental Smile.
She's here with us to talk about the 10 secrets for raising cavity-free kids. And I guess this is a really perfect day because you were saying that even on a day like this, there really are some hints in helping your kids stay dentally very healthy.
Right.
Even on a candy-rich day.
Yeah, even in the candy-rich day. We all know it's the day for candy, so definitely rinse your mouth out tonight. In moderation, everything is good. It's hard to live in absolute, so we want to make sure you take those steps to prevent decay in the first place. And definitely in our society, we're in that trend where we treat the symptoms and not the underlying cause. And unfortunately, dental cavities or caries is one of the leading childhood diseases out there. But the good news is, like we said, it is 100% preventable as long as you start when your child's young.
Yeah, and it helps. You actually have some tips for moms and dads, grandparents out there, to make it a little bit easier, things to keep in mind through your daily routine.
Right.
What are some of them?
So starting out, like I said, beginning in infancy is the best with daily cleanings of your baby's gums. And one of the biggest habits we like to break is parents who put their child to bed with a bottle full of milk or sugar that stays on their teeth all night, and we can get a lot of excessive decay with that. So just avoiding that will make a big difference. Also, by the time their first tooth comes into their mouth, we want to get in the habit of introducing a toothbrush. If they have a hard time with that, you can start with some cotton gauze, but we want to get in the habit of them getting used to a toothbrush and making that part of a daily routine.
Is that even without toothpaste?
Yeah, you can start without toothpaste. You want to talk to your dentist about that. The American Dental Association does recommend after the age of 2 fluoridated toothpaste, but a lot of factors come into play with that depending on if you grew up in an area where there's fluoride in the water, and luckily in Grand Rapids we do have that, so that makes a big difference for us.
So these are all easy steps. I know the first time that we went to the dentist, it was kind of like just an idea to go and see what it was like, and then there were certain things of like counting teeth. What is that first visit like? You know, and what age does that happen, Alexis?
That's a really good question. We say by the age of 3, even if it's not their child's appointment, bring them in with mom and dad for their cleaning appointment or exam. Get them used to the environment of the dental office, meet the staff and the dentist, and make it a really fun experience for them. They can ride up and down on the dental chair or get prizes if they behave throughout the appointment. And that way they create a positive association with the dental office.
And it's nice because you have a family atmosphere because you're in practice with your dad.
Yes, I am. I'm very lucky.
Which is really wonderful. Tell us also about some other tips that we can do with our kids, because, you know, you start thinking about those, you know, just bad habits that can form at a very young age, and really kind of trying to get in there and make sure that they don't become something that's going to have permanently damage their teeth later in life.
Like we said, starting at a young age sets up those ongoing habits that we carry out throughout life. So your children actually do need help brushing their teeth till about age 7, not because they can't brush, but because they can't brush properly. So we like to set up a little game, and parents give us really good feedback with that, with me first, you second kind of thing. So they get excited about brushing their teeth, friendly competition, and then the parents can go back in and get the spots that the child missed so they see what they're doing wrong.
One helpful thing that we started doing when our girls were young is we called them sugar bugs. And so we have to brush to get the sugar bugs out. And we often talk about things now of saying, like, are there a lot of sugar bugs in this? And so we know which things are healthy and which things have a lot of sugar in them. And so you also have some pictures with you today, and I think it's something that we don't get to see with the naked eye, but it's very telling on how some of the bad things that happen to our teeth can start to develop.
Right. We have this fabulous new technology called Spectra. It's one of my favorite diagnostic tools, and it's like Doppler radar for your teeth. Not only does it tell you where exactly the cavity extends to on the tooth, but it also tells you how deep the cavity is. So the good news is that we can target those before they get too big to show up on an x-ray, which usually means you're about to be symptomatic. And a lot of the time our patients don't even have to be numb to remove the cavity to put a little filling there.
Wow.
Okay, so this one we're seeing a lot of different colors.
Right.
So you see the green, which is the majority of the tooth.
Right.
What's the green, and then what are these other colors?
The green, we're looking at the chewing surface of the tooth, and those are all the lines and grooves on that area where food really gets stuck. It's the area that's most prone to cavities. So when we get into the blue, the green is healthy. The blue is where we start to see the breakdown in the enamel a little bit. It's getting weak. So we can target that with fluoride applications or putting sealants on the tooth, and that's for both adults and children, which is important. The red we can remove the cavity and put a little filling there. And like I said, usually we don't even have to numb you, which is always good news for going to the dentist. And then the yellow, we're getting pretty deep here now. It's going to require a big filling. You may be symptomatic already. So we're trying to avoid that by targeting these a lot sooner. And this technology really helps us do that.
Wow, you talk about kids, and when they're that young, they don't have the teeth very long. And so we've got to really take these actions because we've got a long time that we've got to plan for and preserving.
Right.
Take a look at this. What exactly are we seeing right here?
Again, this is Spectra. So first you're seeing just a tooth, the lines and grooves, and then Spectra takes an image of that tooth and then digitizes. And so it's showing us and reading the depth and extent of the decay on the tooth surface.
It's interesting to see where it happens first.
Right. So those areas, like I said, are the most prone to decay. That's where we do most of our chewing, and it gets caught in those little grooves.
Sure.
So.
I was a little surprised when I took my son Jake to his first dental appointment, and they started talking about using these sealants, and I think how far dentistry has come since even we were kids.
Right. Sealants are a great option. We want to break that trend of even having to put a filling on the tooth in the first place. So as soon as the permanent teeth, the molars and premolars start to erupt, we want to get those protected. That way we break that trend of filling after filling that we see going on throughout life.
Fantastic.
Well, this is a great start. You've answered a lot of our questions and hopefully a lot of the questions of the people watching at home. And so we've got information. You're located on Burton. And so fantastic. If people have additional questions, you can just get in touch with Advanced Dental Smile, our new Ask the Expert, which we're so glad. We're going to be seeing you again, Alexis.
Yeah,
this is really cool.
Thank you. All right. Okay, before we head to break, we have some special guests in our studio today.
We do some special Halloween trick-or-treaters, and there we are seeing Alina and Aaron, Brett Thomas and Kai and Gina Thomas there, a little pirate.
And Chris Murphy is here along with Bree, Emma, and Karina. How about that?
Awesome.
Wow, a bumblebee.
So cute.
A little ballerina.
No one too spooky yet.
Love that.
Just adorable.
No, we're saving the scary stuff till later.
You and I, right? Don't go away. We've got a lot of spooktacular things coming up on 8 West.